Welcome back to this final video on wound healing. And in this one, we're going to be talking timeline so you understand how all these things are happening at the same time. So first, let's talk about a wound. Everything we've been talking about is about an acute wound, and the timelines are all going to be referring to an acute wound. And acute wounds are like a wound that has happened. You've got good blood flow. You've got good nutrients, good oxygenation. It's going to repair itself. And basically, in a healthy person, it's going to take about 3 weeks. And then, as I said previously, remodeling will happen in the next 1 to 2 years. Now, in contrast to an acute wound, if that wound has not healed by 3 to 4 weeks, it is now called a chronic wound. That wound has gotten stuck in one of those healing stages, and this is super common. We see these in individuals who have venous stasis, or who have an infection, or who have diabetes, if they have peripheral vascular disease, a bunch of different metabolic diseases, and also just being elderly because your blood flow is not as good. And the good thing about chronic wounds is that careful wound care can really speed up the stages and get you on the pathway back towards healing. And there's a lot of things that we need to do with careful wound care, and that's why wound care nurses are so important. We have to have a dressing that fits the wound. Is it a flat surface? Is it around a corner? Where is it? Is it a place of pressure or not? We need to make sure new bacteria aren't getting in and creating new infections. We need to see if there's too much of an exudate, if it's being absorbed. We need to protect those wound edges where we may have new epithelialization going on. We want to keep moist healing because we want to keep that granulation tissue healthy. So let me talk about different moisture levels when it comes to wounds, the different healing environments. We have a dry, a moist, and a wet one. In a dry environment, we put a dressing on it. Think your typical gauze dressing. It's going to absorb whatever moisture it is, and basically you're going to have a dry wound underneath it. And when you take off the dressing, it's going to be ripping off granulation tissue. And you remember this from when you were a kid, where you had to soak the dressing to try to pull the Band-Aid off because it was stuck to the wound, and that hurt just as much as the initial injury itself. And a moist dressing, which could be as simple as a Telfo pad. Basically, it's going to absorb, but keep some of the moisture so that the dressing itself stays moist. And in a wet environment, that's like putting a piece of saran wrap over it. You're sealing the wound with a piece of impermeable membrane, so all the fluid is staying within the dressing. And you might think that's bad, but out of the 3, dry is by far the worst. And interesting enough, it was the norm for hundreds of years. However, we have all kinds of research that shows on a superficial or an acute wound, it's going to heal twice as fast if you keep it in a moist environment rather than covering it with a Band-Aid for a day or 2 and then letting it be exposed to the air to finish healing. And here is an example of 2 different pictures, standard dressing in a dry wound. You can see you've got a bit of a scab, and you can see it's narrowing down, and everybody look at that and say, oh yeah, that's healthy. But if you had kept that same wound moist after 2 weeks, what you would have seen is completely re-epithelialized. And I'll show you why on the next slide. And so we've got lots of research, like I said before, showing that moist or wet dressings are far more effective. They're going to prevent the tissues from drying out, which helps prevent cell death. It's going to help decrease the risk of wound infection. It's going to increase angiogenesis, going to increase the speed of epithelialization, because, you know, if you got a scab there, you got to get rid of a scab before the epithelial cells can migrate inward. And overall, you're going to have a better looking scar at the end of it. So one of the biggest reasons why the moist healing environment is the best has to do with the speed that those epithelial cells can migrate. If it is damp, it moves faster. Okay, so here is a wound exposed to dry air. Most of us had these on our knees, and this is a knee injury. When we were kids, we were playing kickball or whatever, when we'd fall on, you know, the asphalt or the concrete, and you would scrape your knee. Okay. When the wound's exposed to dry, it looks beautiful, it looks clean, but basically it's not promoting healing, it's promoting let's kill all these cells. Okay, so yeah, the cells are killed, so it's not going to get infected, all that. But at some point in time, what you would realize after a couple of weeks, the scab would fall off, and then finally you would get new skin underneath it. So you got to get rid of this scab or crust on the top, and underneath, you're not going to be getting the epithelialization, and you're not going to be getting the myofibroblasts constricting the wound. In contrast, you have this wound below, which is a moist wound. And at first glance, you go, ick, that looks really bad. What's all that white, scummy stuff on the surface? We need to pick it off. And I'm going like, that's fibrin. Let it be. It's happy. And we've got beautiful pink, healthy epithelial tissue there. That wound fluid provides, that's where the nutrients are, that's where the proteins are, that's where the glucose is, that's where the white blood cells is. So it's going to help prevent wound infection. You'll be able to tell if it's got a wound infection on the surface because all of a sudden you'll start seeing like green pus and it'll start smelling. It'll be real easy to tell. So let's keep that moist environment to keep stuff out of the wound and promote epithelialization rapidly from the wound edges. So looking at our timetable, if we look at our 4 stages, what we can see is hemostasis happens in the first day or so. The inflammation kicks off, is really robust by about 3 days and will continue for a couple of weeks. But at the same time, we're going to start re-epithelialization from the edges, depositing extracellular matrix, and doing wound contraction. In other words, we're going to have that proliferative stage occurring, hopefully for about another 2 to 3 weeks, overlapping with the inflammatory stage. And then near the end of proliferation, that's when we will be starting the scar remodeling, which depending on body location and what else is going on in your life can take a couple of years, but will always take at least 1 year. Don't go back in 6 months saying, I still don't like my scar, because he or she will tell you, come back in another 6 months. You're wasting your time and money. So if we look at what cells are doing what when, it kind of makes sense. In hemostasis, we have platelets. They're there in 30 seconds and they're doing your job. And after a couple of minutes, they're done. You've got a platelet plug, you've got coagulation cascade going on. And what you are seeing is a massive influx of neutrophils into the wound starting about a minute after injury. And that will go on for about 48 to 72 hours, after which they are going to rapidly decrease in numbers. And that's because the monocytes started appearing and they had fairly robust numbers in the 48 to 72 hour part. And their numbers are going to stay high, not only during the acute inflammation stage, but they're going to stay high during the entire proliferation phase. Because remember, at the end of proliferation, they're going to start doing phagocytosis again and killing off other cells. And at which point they will drop off rapidly. So about a month after injury. And remodeling, although it starts early, it really only becomes robust after a couple of weeks, because that inflammation is going to take a week to 10 days. So remodeling becomes a predominant step happening at weeks 2 and 3 and going on for the next year or more. So what does this mean about the strength? Because remember, it's not normal. Okay, it's not what it was before. There is a new normal in town. And so if we look at all these phases, which are like the red and for hemostasis and acute inflammation, then proliferative and the green remodeling stage, what we can see is in the proliferative phase, we're going to start laying down collagen, and in remodeling, we're going to start condensing it and have cross-linkaging, which is going to increase our tensile stage. But even at 1 year, we're only at 80% of the strength that we had before wound healing. And so what's really interesting is you have to realize this is going to go on for a long time. And just because we have little skin going across the top doesn't mean that this wound has normal strength. And this is important for surgical wounds, especially. If you think about what's going on in the inflammatory phase, we have a lot of cell-secreting proteases, right? Which are going to break down proteins, which is going to break down collagen that's there in the wound. And that's what this green line is showing. Here was the original strength before the wound. And as the proteases become active, the old collagen strength just plummets. And it is days before we start building up new collagen strength. And what we see is total collagen strength in blue plummets and has its nadir at about 10 to 14 days after the injury. And this is the typical time where people are feeling good and their surgical wound looks good and they're going home, and they know that their doctor told them, like, even if you had a C-section, don't lift anything heavier than a phone book, if you know, so a textbook, which means you're not supposed to be lifting your newborn baby, but they're going to do what they're going to do. And they're going to, like, yeah, let's go out in the backyard. It's, you know, let's do whatever. And this is the time where wounds will reopen because individuals are not following post-operative advice and post-wound advice, and they are stressing that wound. So please spread that message. And I hope you really enjoyed this section of videos about wound healing. And thank you once again for all your hard work in learning this material. And I will see you soon for the next topic. Bye-bye.